Imagine this. You go to the hospital. You check that it's a network. You show your insurance card. You follow every rule they tell you to follow. And weeks later, you open your mailbox and see a bill for $6,842. Not because you chose the wrong plan. Not because you skipped insurance. Not because you did anything wrong. But because one doctor you never met was out of network. No warning. No consent. No explanation. Just a bill so big it makes your stomach drop. And here's the part that should scare you. This happens to millions of Americans every year in emergency rooms, during surgeries, and even during routine care. Most people panic. Most people pay. Most people never realize they could have fought it and won. But today, that ends. Because in this video, I'm going to show you exactly what to do if your doctor is out of network, how to fight the bill step by step, and how to stop this from ever happening to you again. Out-of-network medical bills aren't just frustrating, they're confusing by design. You're dealing with insurance companies that speak in fine print, hospitals that bill in codes you've never seen, laws you were never taught, and deadlines nobody explains. And when a massive bill shows up, fear takes over. You start thinking, did I miss something? Am I legally required to pay this? What if this goes to collections? What happens to my credit? And because no one explains your rights, you're pushed toward the easiest option, paying a bill you might not even owe. Here's the truth most people never hear. Many out-of-network bills are negotiable, some are illegal, and others can be reduced or erased if you know what to say and when to say it. But insurance companies and hospitals don't profit from clarity. They profit from confusion, silence, and fear. So instead of helping you understand the system, they rely on one assumption, that you won't fight back. This video exists to change that. Today, we're breaking down exactly why out-of-network bills happen even when you do everything right, what the law actually protects you from, what to do the moment you receive the bill, how to challenge and negotiate charges, and how to protect yourself going forward. No legal jargon, no scare tactics. No blaming you for a broken system. Just clear, practical steps that real people use every day to save hundreds or even thousands of dollars. By the end of this video, you won't just understand out-of-network bills. You'll know how to take control of them. Let's start with the most important question of all. How does this even happen in the first place? Absolutely. Below is a high-retention, faceless channel-optimized script with 7 fully developed parts, approximately 350 words each, followed by a strong closing plus CTA. The tone is clear, empowering, and emotionally engaging, designed to keep US viewers watching to the end. Most Americans assume out-of-network bills only happen when you knowingly go outside your insurance plan. That assumption is exactly why this problem keeps happening. Here's the uncomfortable truth. Out-of-network billing is often invisible until it's too late. You might choose an in-network hospital. You might verify coverage beforehand. You might even confirm your procedure is approved. But healthcare isn't billed as a single service, it's billed as dozens of separate providers, all charging independently. That surgeon, in-network. That hospital, in-network. That anesthesiologist? Maybe not. The radiologist who read your scan? Possibly out of network. The ER doctor on call? Not guaranteed. And no one is required to warn you in advance. Hospital staff based on availability, not insurance compatibility. Emergency rooms don't pause care to verify networks. And specialists rotate shifts that don't align with your plan. This creates a perfect storm. You never chose the doctor. You couldn't avoid the service, you had no ability to shop or compare. And yet you're billed as if you made a conscious choice. Insurance companies and hospitals point fingers at each other. Meanwhile, the bill lands on you. Even worse. These bills often arrive weeks or months later, long after you've forgotten the details, making them harder to challenge. This isn't an accident. It's a system built around complexity and delayed accountability. Understanding this is critical because once you realize you didn't cause the problem, you stop blaming yourself and start defending your rights. And that leads us to the most important protection most people don't even know exists. If you remember only one thing from this video, remember this: you are not automatically responsible for most surprise out-of-network bills. In the US, a federal law called the No Surprises Act was created specifically to stop this kind of financial ambush. Here's what it does in plain English. If you receive emergency care, you cannot be charged out-of-network rate CVON if the doctor was out-of-network. If you receive non-emergency care at an in-network facility and an out-of-network provider participates without your explicit consent, you are protected. That means no surprise balance billing, no inflated out-of-network charges, no being forced to pay beyond in-network cost sharing instead. Your responsibility is limited to what you would have paid if the provider were in-network. The fight over payment is supposed to happen between the hospital and the insurance company, not you. So why do people still get these bills? Because insurers don't always intervene automatically. And because many patients don't know the law exists, the system still relies on silence. If you don't challenge the bill, it often gets processed as valid. If you pay it, the protections no longer matter. The No Surprises Act doesn't work unless you invoke it. And the moment you do, the power dynamic shifts. Suddenly, you're not begging for help, you're asserting your rights. Next, let's talk about what to do the moment that bill shows up, because timing matters more than you think. When you open an out-of-network bill, your instincts will scream one word: pay it. Don't. The first rule is simple: never. Pay a surprise medical bill before reviewing it. The moment you pay even partially, you weaken your leverage. Here's what to do instead. Step 1. Pause and document. Save the bill. Note the date received. Step 2. Check the explanation of benefits EOB from your insurer. This is not a bill. It explains what insurance processed and why. Compare provider name, service, date, network status, amount billed versus allowed. If the provider was out of network, but the care qualifies under the No Surprises Act, that's your opening. Step 3. Call your insurance company first, not the hospital. Say this clearly. I'm requesting this be reprocessed. Use calm, confident language. You're not asking, you're stating a fact. Step 4. Request a formal review or appeal. Ask for the claim reference number, written confirmation, a timeline for resolution. Document everything: names, dates, call IDs. This process alone resolves many bills, and if it doesn't, that's where escalation and negotiation comes in. Hospitals and insurers respond to structure, not emotion. Start with a written dispute, even if you've called already. Your appeal should include your name and policy number, the date of service, the provider's name, a clear reference to the No Surprises Act, a statement that you did not consent to out-of-network care. You're establishing a paper trail. If the insurer denies the appeal, federal law allows for independent dispute resolution, a neutral third party who decides what's fair. Hospitals don't want this. Costs them time and money, which means many bills suddenly become negotiable. And yes, negotiation is allowed. Not every out-of-network bill falls neatly under federal protections, but that doesn't mean you're powerless. Negotiation works because hospitals expect it even if they don't advertise it. Start by asking, what is the self-pay or cash rate for this service? Many times, it's lower than the insurance billed amount. You can also ask for a hardship reduction and itemized bill. This alone reduces charges, removal of duplicate or miscoded services. If you're willing to pay something, offer a lump sum settlement. Hospitals prefer guaranteed money now over chasing payments later. Have time. Use it. The best fight is the one you never have. Before any scheduled procedure, ask if all providers are in network. Request written confirmation. Ask about anesthesiology, labs, and imaging use this phrase, "Can you confirm that no out-of-network providers will be involved without my consent?" For emergencies, ask for post-care billing review. Immediate insurance coordination documentation creates accountability, and accountability prevents surprises. Here's the uncomfortable truth. The system survives because people comply. Every unchallenged bill teaches hospitals and insurers that surprise billing still works. Every payment reinforces confusion, but every dispute pushes back. When patients assert their rights, billing practices change internal policies, adjust transparency increases. Fighting your bill isn't just about saving money, it's about refusing to accept a broken process. You deserve clarity. You deserve fairness. And you deserve care without fear. Out-of-network bills feel overwhelming because they're designed to be. But now, you know better. You know why these bills happen, what the law protects, how to fight back, and how to prevent it next time. If this video helped you feel more in control, help others find it too. Subscribe for clear, no-fluff healthcare breakdowns. Like this video so fewer people overpay. Comment below with your questions. I read and respond to everyone. Your health matters. Your money matters. And now you know how to protect both.